the JAMA Network.
We know that end-of-life care is intensive. We know it's expensive. We know that still too many people are dying in the hospital, even today.
The United States is not the worst in end-of-life care, at least when it comes to cancer patients, nor is it the best.
Drs. Ezekiel Emanuel and Justin Beckelman from the University of Pennsylvania Perelman School of Medicine and co-authors compared the healthcare experience for cancer patients older than 65 in 6 countries and the U.S. in 2010. Those countries included Canada, Belgium, Germany, England, the Netherlands, and Norway. They examined several clinical measures 6 and 1 month before death.
The United States and the Netherlands had the lowest proportion of patients dying in the hospital.
About 22% of U.S. cancer patients died in hospitals, almost 30% in the Netherlands, and Belgium and Canada had just over 50% of patients die in the hospital.
We have the fewest hospitalizations, and we have the shortest number of hospital days of all patients.
The U.S. wasn't as expensive as we might have thought or might have predicted.
During the last 6 months of life, patients in Norway and Canada had higher hospital costs than patients in the U.S. There was less spending in Germany and Belgium, but the lowest expenditures were in the Netherlands and England. The study appears in JAMA, Journal of the American Medical Association. Both researchers note that there are areas where care can be improved for U.S. patients.
The United States has far and away the most patients who end up in the intensive care unit in the last 6 months of life. About 40% of patients actually end up in the intensive care unit. They spend the longest time of any country in the world. We also give a lot of chemotherapy to patients in the last 6 months of life.
A question is for our patients, if they wrote the chapter about their last 6 months or about their last month, would it resemble the findings that we're reporting? And I'll bet the answer is no. And that means that we have more work to do.
Catherine Dolph, The JAMA Report.